Appreciate your sound, need a renovation. Appreciate your sound, need a renovation. Appreciate your sound, need a renovation.
Hi everybody, Kim is here.
Music brings us together, even when we're apart. That's why we support Canadian musicians, festivals, and award shows. It's just one of the ways TD's Ready commitment helps build a more inclusive tomorrow.
Hello.
Atiga Mackenzie, Labrador Miyunguvunga. Before we begin, we would like to acknowledge that this event and the Halifax Pride Festival take place in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the treaties of peace and friendship with the Wabanaki peoples. We recognize that reconciliation requires action in support of words. We commit to working with and supporting Indigenous communities, and it is important that we work towards identifying and uprooting all systems of oppression.
Thank you. Are we good to go now? Okay, all right. Thanks, everyone. My name is Kim Vance-Mubanga, and I'm based here in Halifax, Chibukchuk, and I will be your moderator for today's session. I'm very happy to see some old friends and some new folks working in the global LGBTIQ activist arena. I'm very happy to be able to join you all on Zoom. I wish we could see you in person, but this is the way it is right now. So I do have a couple of introductory statements to make, just a little bit about this panel series. You already heard the kind of land acknowledgement from where this panel is being hosted today, but I recognize we're all in different places. Today's live event is part of a series of panel discussions across Canada on global queer, trans, and intersex rights in a COVID-19 world. It's being co-presented by the Dignity Network Canada, QP National, ARC International, and Fierté Canada Pride, along with Halifax Pride as our local organizing partner. The Dignity Network Canada is a coalition of Canadian organizations that support the advancement of human rights for LGBTIQ people globally, and they've brought us all together today. I also want to acknowledge the generous financial support of CUPE, the Canadian Union of Public Employees, which is Canada's largest union with 700,000 members across the country, representing workers in healthcare, emergency services, education, early learning and childcare, social services, libraries, transportation, and more. This has been a very essential union for us, especially in these times. And we want to thank CUPE for their incredible work. Sponsorship funds from CUPE will be going towards the organizations that our guests are involved with working on human rights in their countries and regions. So I'm going to just get the ball rolling and just introduce everyone by name, but then I'm going to invite you all to say a bit about yourselves. So first I want to welcome Tina, who's joining us from Hungary. Hi, Tina. Last time I saw Tina was in Brazil. So Vivienne, who's joining us from Brazil. Oi, Vivienne. Georgia Z, who's joining us from Lebanon. Steve Letsiki, who's joining us all the way from Joburg. Hi, Steve. So I'm very grateful that you could all join us for this discussion. I know you've had a chance to look at the questions ahead of time. So we'll start right in. And I think the order for the first question is that we'll start with you, Steve. This is just a quick snapper, a 1 minute or less, to just give us a quick introduction about yourself and your work and your preferred pronouns throughout the course of the panel presentation today.
Thank you so much, Kim. Good evening to you and to my fellow panelists. And I must appreciate the invitation to join into this conversation. I think it's such an important time where many things are taking place, in this part of the world, but also your part of the world. My name is Steve Letsike. I am the Executive Director of Access Chapter 2, which is a human rights organization focusing on LGBTI persons in South Africa. We do quite a lot of direct service, legal support, advocacy around policy change, but also to hold our government accountable in South Africa. We are part of the Commonwealth Equality Network, which is advocating for decriminalization in 54 countries of the Commonwealth. And we do quite a lot of partnership, of course, with Outright within the UN space and many others. So thank you so much for this invite, Kim.
Thanks, Steve. And now we'll go to Vivienne.
Hello, everyone. This is Viviane Vergueiro. I'm speaking from Salvador, Bahia, Brazil, which I also would like to recognize as the stolen land from many indigenous communities, such as the Tupinambás. I am project coordinator with Fakahata, which is a working group in genders and sexualities. We do workshops with activists, professionals, and also incidents in spaces like the OAS, the Organization of American States, or the Human Rights Council from the UN. And I'm also part of the International Trans Fund's steering committee. So these trans issues are one of my main concerns. Also in terms of research, I'm a PhD candidate in gender studies here in the Federal University of Bahia, and part of a research group named NUCUS, which has a fun, intentional meaning in Portuguese. If someone knows Portuguese, they'll understand. I have a focus on trans studies, so I guess many of the elements in this conversation will emphasize trans communities, but I'm also concerned about the broader LGBTI communities as well. And I'm really happy to be in this conversation, in this dialogue, and meeting other people. My pronouns are she and her, and yeah, that's it. So glad to be here.
Thanks, Vivienne. Now we'll go to George, who's back with us. Welcome back, George.
Hi, thank you. Thank you for having me here. I'm sorry I had to leave because we live in a country where we have a lot of electricity cut. So I was forced to disconnect and come back waiting for the generator. So my name is George. I'm from Beirut, Lebanon. The co-founder of Halim, the first LGBT organization, the co-founder of MARSA, and currently founder and executive director of the Arab Foundation for Freedoms of Equality. We are based in Beirut, but we work on a regional level across the Middle East and North Africa with a focus on capacity building, research, advocacy on a regional and international level. And we work a lot with the media as well, trying to counter the narrative around LGBT issue in mainstream media.
Thanks, George.
Pronoun is he, him.
Thank you. And last but not least, Tina.
Hi, everyone. I would also like to thank Halifax Pride and Kim for the invitation and for organizing this panel with the other amazing panelists. I'm really looking forward to learn from them. I'm a privileged white European person calling in from Hungary, from Eastern Europe, and I'm a longtime trans activist. I'm one of the co-chairs of Transgender Europe, and I've been also involved with the International Trans Fund grant-making panel in the past. But today I'm representing the only trans organization in the 10 million persons country, Hungary, which is named Transvanilla Transgender Association. I'm one of the co-founders and vice presidents of the organization. And as the only trans organizations, we are trying to cover whatever we can. So we do advocacy, we provide services to trans people and their families, and we kind of try to do whatever we can. So I'm really looking forward to today's chat. Thank you. My pronoun is they, them.
Thanks, Tina. And we're actually going to stay with you as we move into question 2. You get to start us off. Our viewers globally, but also in Halifax, might not know much about the current situation around LGBTI rights in your country or region. And also, of course, given the current situation that we're in globally with this pandemic, you know, can you just spend a few minutes talking about what have been some of the main challenges for you in your work, and in particular, how COVID-19 has been impacting that work?
So if someone doesn't know too much about Europe, might think that everything is good there because human rights are okay. And since Hungary, my country, is a member of the European Union, it would look from the far that everything is okay. But that's absolutely not the case. Things are going worse and worse in this region. And I mean, there are huge differences in the region. Western Europe, Southern Europe, Northern Europe, and Eastern Europe are all different regions. And in Eastern Europe, there are many, many worrying issues. And Hungary is one of the leading countries in that, unfortunately. So I'm kind of presenting all the time how we bring shame to Europe. And things were difficult, even before COVID has arrived to us. We have a government for 10 years now, which is not cutting back rights, but is having a discourse which is full with hatred and builds on fear of people and is attacking LGBT people in general. But that's a discourse. And despite that, we had almost proper legislation on paper for almost everything except very specific trans issues, namely legal gender recognition and trans-specific healthcare. These were a nightmare. My organization has advocated for 6 years for a legislation on legal gender recognition. We had a practice which was relatively okay and was pretty much functioning, but knowing the government, this was not backed up by any legislation. We've been advocating for legislation, which we got in the middle of the pandemic, when the Prime Minister of Hungary decided to rule by decree indefinitely, and he was tasked by the parliament with that, and he was blamed to put the parliament aside. The government found a way to prove that parliament is still functioning and they are making laws, and they have introduced an omnibus bill with several issues on that. There was only one point attacking human rights clearly, and that was legal gender recognition. So Hungary became the very first country on the global level to ban changing gender markers for anyone. And that was COVID for us, basically. I could say we are fortunate because the pandemic is not hitting hard on Hungary. It's hitting somewhere in the region in other countries, but for us, it's not as bad as for other regions, maybe. We have economic issues, obviously, and our communities are affected a lot by that. But I think the most severe attack for us and for the whole LGBT community was this taking away rights clearly by the government without thinking of anything. I mean, all international human rights mechanisms have condemned the government. They have called on the government to not go forward with this proposal. We know that we will win at courts, but still the government wanted to make sure that sex registered at birth cannot be changed anymore. And we have a huge question mark. Who is next? Who from the LGBT community, who from other marginalized and oppressed communities is gonna be the next? And it seems that the European Union kind of powerless, and it can do nothing when a member state violates clearly human rights of its own citizens. So I think those are the issues that I'm bringing to the table today.
Thank you for that. And yes, we were all very concerned when we heard what was happening in Hungary. And it's true that during COVID, it becomes very hard to kind of mobilize. The spaces have been limited. And so definitely there's a challenge when there's regression to mobilize. George, we're going to go over to you. I know there's also been many challenges in Lebanon, so maybe you can describe some of what's going on.
Well, I think I speak about Lebanon because if I go to the region, I don't think we'll have enough time. We are in a country that is already going through a big economic crisis. I mean, we obviously have electricity cut. The Lebanese pound is falling. So there's a lot of challenges that were happening, and COVID-19 came as a perfect opportunity for the government basically to oppress the opposition by locking people down, by limiting, advocacy activities, and the LGBT community being already in a very difficult position was one of the most hit communities in terms of how the government was trying to limit the space of freedom of expression in Lebanon. And when it comes to the economic crisis, everybody is going back to their family, to try to consolidate the resources. People are losing their jobs. So, but when it comes to the LGBT community, especially during COVID-19, when everybody was going back to their houses, to the safe place, this didn't apply to the LGBT community because their families is usually where they're facing the most aggression. So we are speaking about the community that's left without a family, without any resources, without nobody to go back to, while most of NGOs, they had to close down because of the restrictions as well and the COVID-19. So it has been really a difficult time for us trying to find alternative spaces to address these issues, to help the community, to basically create a solidarity movement between the community, providing basic needs in terms of food and cleaning material for the community. In addition to this, what most the trans community being with a lot of focus on sex workers were the mostly hit during also the COVID-19 crisis. So definitely they were the ones left without any kind of assistance and without any kind of resources. So these are different layers of social, political, and economic situation now that makes the situation very complicated for the LGBT community, and especially that for the international community. Usually this is the first thing that drops in terms of priorities when they want to address something with the government. So now in Lebanon, they want to address the economic crisis, the refugee crisis. So it's not something that the LGBT comes in terms of priority on the top of the list.
Thank you, George. And thanks in particular for pointing out the challenges around people engaged in sex work. It's been a big issue. And I'm sure others will talk about that as well. Viviane, we're gonna head to Brazil now, get your perspective.
Thanks so much, Kin and Tina and George for the insights. It's important for us to share this solidarity in understanding our context. So yeah, people sometimes see some regions from afar and they think, okay, there everything is fine, and it's not like that many times, especially for LGBTQ communities. I'll talk in general about Latin America because there's some common traits, but also with a sort of a closer glimpse into the Brazilian context. But survival needs are a major critical issue for many people in the LGBTI communities, especially racialized, poor communities, and non-white Black communities, indigenous communities, and in particular about trans communities as well. There's some projects involving provision of shelter and food that have been facing difficulties because it's a much larger demand that they're facing. So this is something I would like to recognize. I also hear and read about the domestic violence and mental health being two different important issues for our communities in the region and in Brazil as well. The effects of increased militarization and control of public space, especially in places like Brazil, or places where the pandemic has been having a more severe impact. This has also been an opportunity for some governments to increase control over the population, repressive control over the population. I would like to mention Peru and Panama, who had gender-based lockdowns, which had some awful transphobic episodes, for instance. It's been economic rupture for sex workers, informal workers, which comprise many people in the LGBTI communities. There's an absence in general of directed public policies for LGBTQI people during the pandemic, and even difficulties to access general population policies. I would like to finish with the mention of the political threats around the mobilization of gender ideology narratives. This has been going on in many places in Europe, in the African continent, and Latin America has also been an awful stage for these politics as well, which has impacted in the dismantling of LGBTI institutionality, like public policies, government spaces, decision spaces, and discriminatory policies and projects gaining ground, such as one banning trans people from sports, from participation in professional sports in the state of São Paulo. So it's a difficult context in a broader context of general precarization of public services and workers' rights. So I think this is an important tie to make when we think about the specifics in our gender diverse, sexuality diverse communities as well.
Thank you, Viviane. Viviane, can I just ask you just to a little bit more detail just for our audience members, because I think the idea of a gender-based lockdown might be an idea that's very not familiar to us in North America. So if you could just explain that a bit more for the audience, what that looks like, what that means, especially for trans folks.
In Peru and Panama, they had, I think Colombia, in some places, they also had this policy that involved dividing the week. So in some days, like Monday, Wednesday, and Friday, only women can go out in the streets. And Thursdays and Tuesdays, only men can go out in the streets. So I guess people in the audience can assume, can figure out how that impacted trans people. So some trans women were detained because they were not supposed to be in the streets because they were supposedly men to the authorities. This has had some visibility internationally, but yeah, and there was basically no foundation. It's also within an anti-scientific context because there was no foundation that these gender-based lockdowns would work in any sense to control or to face the pandemic. Thank you for asking. Thank you.
Thank you. Steve, we're gonna go over to you. I know there's been a particular situation in South Africa, but as much as possible, if you can also give some maybe Pan-African regional sort of glimpse of what's going on as well.
Yeah, no, thank you so much, Kim. I mean, look, South Africa is one interesting country. We have a constitution, that is celebrated globally. I mean, it was enacted in 1996. And this constitution had guaranteed, freedoms, have guaranteed non-discrimination and the equality. But 26 years later, as a country, we're still struggling to transition to testing fully, the might of law and the rule of law and the constitution itself. And that's one of the biggest issues, where, our government has ensured that policies are in place, but practically has not ensured that the programs do speak to the policies that were enacted. When you look at a law as old as 2003, sex change law, where you have trans person who can undergo surgery, hormonal replacement therapy, and so forth. But more and more, in fact, if I tell you, Kim, just last year we were looking at how many hospitals in South Africa, out of 3,600 facilities, primary health care and hospitals, only 4 hospitals were competent to provide trans competent services. And this year, I tell you, in fact, these units have now been shut down. So now we are going to be facing a bit of a challenge in terms of what level of competence is available and how do trans population access competent services. But secondly, it's not only just issues of access to health, it's also issues of applying for the gender marker. And the period it takes, to ensure that people are not constrained by the legality and the process of identification and identity documents. So it's becoming more and more difficult when you go into the service provision of access to service. So these rights that are enshrined in the Constitution then becomes it's not a lived reality. Some three issues that are biggest challenges also pertains the issues around gender-based violence. I mean, South Africa generally as a country, we are suffering from high levels of gender-based violence and femicide. And just recently, the president has launched a national strategic plan to combat gender-based violence and femicide. You would know, as you've interacted with South Africa before, hate crime legislation, hate crime bill has been going on for such a long time. Even today, 20 years after starting this first conversation, the hate crime bill is still not in place. But these are some of the issues, and COVID is making it more and more difficult. The economic situation, the livelihood discrimination, it's some of the high level issues that we still are faced with. And even now, what we've seen during the lockdown regulation that was enforced from March, a lot of LGBTI people are stuck with homophobic and transphobic families. We've received quite a lot of cases. People are rejected by their families, and there aren't shelters that are available to provide immediate safety and security for LGBTI persons. But not only that, we've also been seeing intimate partner violence amongst LGBTI community. It could be brewed by economic tensions and so forth, but also generally, in the nature of violence that we're dealing with in South Africa. I mean, of course, we just a few months ago, we celebrated, another country, Gabon, that decriminalized. And I think it's one of the positive aspects of the work itself in the region. One of the biggest disheartening problems that we're experiencing is the situation of Kakuma, which is a refugee and asylum camp in Kenya. There's a group of LGBTI, particularly, I think, also the trans community that is stuck in the Kakuma camp, and which is a refugee camp in Kenya. And we are worried that the United Nations is not taking, the refugee agency is not taking action, and it's not taking accountability, because this situation has been brought to the attention of the authorities of UN, of African Union. And my biggest fear is that only people will act when these lives have been costed. And that's our experience, because our bodies become site of struggle. Our bodies continue to be a challenge for many issues. And that's what we see. In 31 countries still criminalize homosexual act in Africa. And that's the battle that we are dealing with in the region. Thank you.
Thanks so much, Steve. And thanks also too for really zoning in on not just gender-based violence, but also intimate partner violence within LGBTIQ communities. And I think what's important, what I'm hearing from all of you, and I want to bring this back to our home audience here, is that we're seeing this every sort of single point, maybe aside for the gender-based lockdowns, but everything else is also happening here in North America. We are seeing regression of rights. We are seeing huge levels of intimate partner violence and gender-based violence. We are seeing huge issues with the impact on sex workers. So these are global issues. They're being driven by the pandemic, of course, but these are all issues that we continue to work on in all of our regions and countries. The next question is about how the international community, and I don't just mean sort of global north, I don't mean this kind of savior thing. This is not the kind of question I want to ask. I want to ask about like real solidarity. How can the international community come together and work in solidarity to support the kinds of global LGBTIQ issues and communities that are in crisis around the world right now? So what's your vision for how that could work? And I'm going to go to you, George, because you keep cutting in and out, and I know we've got you right now, so we'll get you while you're on the line.
Yeah, I'm sorry for this. I think that what happened with COVID-19 is that it created a lot of domestic issues for everybody, and everybody is suddenly, closing back down into their countries, trying to focus on their own situation. And in a lot of countries, especially in countries where the community is really fragile, they count a lot on the exposure that comes from international partners. We know that if anything happens, our international partners will react, and we need to be careful now. And the local governments, they're aware of this. They're aware that everybody is busy with different things. So it's the right time if you want to go after activists or after the community. Now it's the right time. So I think it's important for us, despite all the challenges that we have domestically, to keep listening and knowing what's happening elsewhere, to make sure that, our voices are still heard, that in countries where, they don't have access to the government, at least we have still our international partners' voices that are still listening to us and knowing what's happening. I think this kind of meetings that we're having now, I'm really, really happy to see that we're opening up again, and I'm meeting, these faces, we're talking together, we're strategizing together. So this is something that needs to keep happening, and to understand the needs in different countries and other challenges that's coming, especially with COVID-19, and how we can assist each other. Keeping the channels open, in short, this would be the answer for us moving forward, trying to find alternative ways for us to stay connected together and listening to our needs.
Great, thanks. Vivienne?
Hi. Yeah, this is a great question, actually. And I sort of focused in a sort of a global North audience, since, we're talking in English from Canadian space. But I think there's things that we need to work collectively on. So I guess coming from sort of this funder, donor environment, I think one thing that is critical for LGBTQI communities around the world is to have more flexibility and focus in supporting global South and intersectionally affected communities. Many times because of language barriers, because of skills that are likened to corporate ones, and other reasons, many organizations doing critical work are precluded from applying. And this is particularly true for trans and gender non-conforming communities. So finding ways to broaden the spectrum of funding is critical, in my opinion. Challenging the economic asymmetries within and outside your local national context. This is a general thing, but being affected by discourses on veganism and other ways, I think there's linkages between everything we buy and consume to the general macro effects that has. So being aware that international work is on your cup of coffee, is in your, I don't know, everything you touch and see during your day is an important thing. And because this is a system that is designed towards inequality, injustice, and exploitation. One thing that I would like to mention is that the pandemic has brought important discussions about healthcare to the fore in the world, especially in terms of universal healthcare. We have a public universal healthcare in Brazil that has been under destruction for many years because of austerity measures and other things. So, and because of private interests as well. So I think it's fundamental for the international community to transform the linkages, and this is especially for global North countries, between economic austerity and each country's ability to provide basic needs, basic resources to their constituents. And finally, I think that we need to find collective ways involving workers, involving people from racialized communities. And I'm saying that as a part white, part Asian, East Asian person, but ways to transform international governance and justice. Because exporting exploitative capital, exporting wars, guns, and prisons has not been working. And just to refer to two academics I appreciate from North America, Viviane Namaste and Dean Spade, I think their insights are critical for us to rethink this world. And yeah, maybe take this pandemic at least as an opportunity to rethink the way we, as an international community, relate to each other.
Thank you so much. And I think that really highlights this important notion that, I think actually we've gotten away from this. And if the pandemic can do anything positive, it's to really bring us back together around some of these universal issues that I think have been siloed away. You know, we're working on LGBTI rights only and that what that looks like in a silo, but talking about things like access to universal health care, those things are like extremely important, and they're part of LGBTIQ activism. They're part of the work that we have to do globally. Steve, we're gonna go over to you now to just talk a bit about international solidarity and how we can all work together around some of these challenges.
Yeah, no, thanks, Kim, for that question. I think first it's to recognize that for us in South Africa, and I think particularly sub-Saharan Africa, COVID pandemic adds to many other pandemics we are dealing with. If you look at in South Africa, this is pandemic number 5. Our first pandemic, TB is number 1 killer, tuberculosis, and HIV. South Africa is the highest HIV, epidemic, because of our new infections. 7.9 million people in South Africa are living with HIV. The second one, of course, which is maternal mortality and infant mortality. But we're also struggling with non-communicable diseases. We are struggling with violence and injuries. So when you add COVID, you already are adding on an already overburdened system. The health system is overburdened. The livelihood, economic situation is so overburdened that all the time, priorities are shifting, resources are shifting to respond to pandemics. And what we're also seeing is that the civil society space, no matter how vocal, vibrant, and alive is the civil society in South Africa is, at some point we're still asking ourselves whether we will have doors open of important work done by organization in the next couple of months. So I think for me, what we've seen by virtue of having this conversation, and I'm really excited and happy that Doc has always invited us to converse about the work that we do from policy to action. But also we're seeing other solidarity that is built by Outright International, by Give Out, where it's responding to the emergency situations that we are dealing with. There's quite a lot of hunger, poverty that is striking in, and we need to ensure that people have access to food, and we are not even sure whether this will be sustainable. Distributing a food parcel that will last a month, what happens next month? So we need to think about what is the sustainability plan going on. But secondly, the issue around the messaging of social distancing is very problematic, because for us as the LGBTI community, as trans, as intersex, as lesbian and gay people, we have been socially distanced all our lives. And here we are, from a public health threat, we are still told social distance. And I think we need to look at, and we have been having this conversation with World Health Organization and even with the Department of Health here. Some parts of the provinces have already adapted to using physical distance as opposed to social distance, so that we can still be able to support the mental health, the tension, address the stigma, because already COVID, a pandemic, it's creating a lot of stigma and discrimination. And with our history of prejudice in the region, our history of prejudice in South Africa, stigma has been one of the biggest issues. So I really do think there's a need for continuation of support, also because allies and stakeholders from outside our countries have also a sense of influence to their own governments. What conversation is happening, Kim, if you're in Canada, with the Canadian government, that the embassy here still remains active to support the work of organizations? What additional conversation that must take place? Because our biggest fear also becomes how our countries are exploited during this time. And because we are developing countries, the bilateral agreements are somehow taking a different shape as well. And as much as economy is a big issue, and economy is, in its own tatters now, bilateral agreements and multilateral agreements are taking a different shape. We're going to see a high level of corruption. It's exploiting our government in inequalities, and what conversations around human rights protection are in the foreign policies that many of our countries have that should take place. And I'm glad Vivian is here from Brazil, and it's quite important because you have also a forum such as the BRICS Forum. What conversations are happening with the BRICS Forum, to ensure that we do not miss the opportunity? China, which is taking over the whole procurement of protective gas in countries and so forth. But we know exactly, because it's like holding the economy ransom. We're going to be hit by a second strike of colonization in Africa by China, because one way or the other, we have to be honest in terms of how China is taking over economically. So some of these things is, how do we safeguard the human rights of LGBTI persons? And I think that's the kind of solidarity and conversations, Kim, that are quite important now more than ever.
Thanks so much, Steve. So much in there to be thinking about and processing. In particular, that, really highlighting pandemic after pandemic after pandemic. And I'm just thinking too about how, our donor policies from Canada silo things in either in humanitarian or human rights. There's no linkages between those two often. And right now, groups are in the middle of the 5th or 6th pandemic, and you can't really take apart humanitarian versus human rights kinds of strategies. They coexist within the organizations that you're working with. So big issues there. Tina, we're gonna finish off this round with you and your thoughts on sort of working together and some international solidarity that needs to happen.
Yeah, thank you. I think so many great things were already said, but I try to add something. We believe at Transvanilla that we are watching as the world we have known is falling apart, and we believe that the human rights movement should be one movement. And then we should not talk about intersectionality. We should just all work together from different fields of human rights work. And then we could kind of put the puzzle together and try to reach out to more people and to those who are more marginalized or suffering more or oppressed more. But unfortunately, we also have to acknowledge that sometimes it just fails and we don't get the support. And I can tell you that the trans community is invisible in Hungary, and we are not powerful, and we have nothing basically. And when we were attacked, what helped us to survive as a trans organization, and what helped me to survive as a trans activist, when I was silenced and ignored by civil society in my own country, whilst my community was attacked, that was international solidarity. All different kind of international actors reached out to us and effectively helped us. And I think that's a great sign to us that it's still working, and we can still raise our voice and it is amplified by someone. And I think it was really crucial, and it's important at all times to reach out to those who are affected by something particularly and involve them. So that is one thing that I would like to highlight. And the other thing is that international solidarity is not just to reach out to each other and to talk abroad with people, but it's also to make the situation as good in your local context as possible. It's not enough to take care of trans people in other countries, for example. Maybe there is someone in your surrounding who you can help, and please just reach out to them and make the situation as good as possible on your local and your national level first. And then if you still have energy, then try to help others, because it's very important. I mean, Europe is failing on so many levels, also the US nowadays, but we need good examples. We need good practices. So try to develop them, because that's also solidarity. The better the situation gets in more places globally, maybe that has an effect in other places. I mean, that's the only thing that helps me to survive. I have to believe in something, and this is something I'm really passionate about. I try to be brief.
No, thank you, Tina, and thanks for giving us some sense of things that have worked and been inspirational for you. That's really important. I'm going to bring us back to sort of a situation that I know is sort of on the news all over the world, but just to kind of highlight that here in North America in particular, we've seen the COVID crisis sort of have a disproportionate impact on Black and Brown communities, even to the point where we can't even get data on how it's disproportionately affecting Black and Brown communities because the data collection is insufficient to give us that information. And certainly over the past couple of months, we've seen uprisings in support of Black Lives Matter, talking about inequality and police brutality. I know you've already referenced intersectional work in some of your comments, but I'm wondering, thinking about some of that, if there's any insights or thoughts on intersectionality across movements and across borders during this time that you might have, or maybe how you've worked through some of these similar types of situations in your contexts. And we're going to go back to you, Steve, to start us off on that.
Kim, I think for me, the most important thing it's the coming together. You know, there's something that we need to reflect on as partners, as organizations, and as activists. You know, some of the issues that I always raised, I mean, we have been working throughout COVID, for instance, nonstop. And more and more, I feel so exhausted, you know, because we had to respond to crises that are even difficult, and they are so emotional and psychologically affecting all, you know, many of us that are involved in the front line. And I think there's a need really for how we structure support accordingly. And part of it, it's also about, you know, the great work that is being done by many international organizations. You know, first, the voices that you find in the UN by sharing quite a lot of, you know, challenges, human rights violations that are taking place. I mean, if you take ARC International, if you take Diversity Network and many others who have been doing quite, you know, important work in collaboration and in solidarity with many of us. But I also do think that even our own regional mechanism are quite important. And this is where we need to even channel resources, you know, to actually work in our own regional contexts, because it's really quite important to do so. But also domesticating this. If there's one thing that we know very well here in South Africa, we are quite hopeful of, you know, our own judiciary system. If, you know, we can hold on to that, we can test democracy through the judiciary system itself. And I really do think, you know, there's still quite a need to see how best, you know, many partners with experience can collaborate more. There's great lessons, you know, that are taking place in of course, North countries, but also there are great lessons that are taking place in the Southern, you know, context. We launched a campaign just now recently, Kim, called Inglebalam. Inglebalam, it's speaking about the wound. So for many of us here in the region, we've been told every day of our lives how un-African it is to be gay, lesbian, trans, or even intersex for that matter, questioning our own bodily integrity and self-determination. And I really do think we wanted to demonstrate exactly what wound has been inflicted, and even in the context of the wound, how we all have conquered even in those spaces. The fact that we've been prayed for, you know, as our daily life, as young as we were, but we are still who we are. And I really do think the reflection of work, the reflection of practical example of services, of policy change can be learned throughout. So an exchange of some kind, but also an effort that we put towards a specific regional work, whether in the Caribbean, whether in Africa, in Pacific Island, but also as Tina had highlighted, that situations are changing even in the Western countries. So I think that solidarity even amongst all of us is needed.
Thanks so much, Steve. Vivienne, we're gonna go to you now.
Great, it's great to hear everyone, and thanks Steve for that. I would like to comment maybe on the lines that Tina started saying in the beginning. I guess that for many people, maybe North America is a great dreamland for LGBTI people, and episodes like the racist attacks and from police and from other institutions are also shed light into the inequalities within contexts that we might think they're fine. For instance, the lack of universal health care in the US is a major problem that affects many people, especially racialized poor people. And I guess it's important for us to have solidarity, international solidarity, to tackle these problems. I would like to mention in that I think it's also important to consider the relative visibility in how global North events are shared around the world versus the anti-racist movements in countries like Brazil and South Africa, which are very unequal countries. We represent to some extent like two of the most unequal countries in the world. And I guess that for many people within Black movements in Brazil, there was some kind of frustration with white people like me and the larger community about the relative visibility police brutality from North America has amongst middle class or the general public in global South context. So I would like to recognize that and how we as an international community get more even in terms of our collective visibility. Yeah, I think intersectionality is critical for us to understand the geopolitical context of our world, and it provides an analytical way to think about these problems. I think it's also related to the concept of coloniality, which is fundamentally the present of the colonial. I don't want to say past, but in the way that history is framed, it seems that it's a past that is far, far away, and coloniality is one concept that emphasizes the present of its consequences and effects. So the present of this hierarchical supremacist imaginary of European and North American whiteness, patriarchies, royal families, these are things that we need to face through intersectional analysis, in my opinion. And one thing that I would like to finish saying is that this involves mutual learning about the strategies, about institutionalities. Steve mentioned the HIV and that this is the COVID-19 is not the first pandemic South Africa faces. And sorry.
Yeah, we just lost your volume there for a minute.
Unstable. Sorry. But, Brazil and other countries have had interesting responses to the HIV epidemic. And I guess this is also important. It's not only providing resources to global South countries, but also engaging in mutual learning about what works. It might surprise many, but we do good stuff as well. We face similar challenges, graver challenges at times, but we also find strategies of resistance, collective responses to things. Steve mentioned the constitution. The Brazilian constitution is still seen as a good constitution in terms of rights, but global capitalism is supporting our current president to some extent, and it's important to see that.
Thanks, Vivienne. And thanks really for zoning in too on coloniality and sort of the impact that that's having here in North America too, in terms of both these movements around Black Lives Matter, the residual effects of slavery and trafficking across nations, and two, for Steve pointing out sort of new colonial sort of waves and how that plays out in terms of China's role in throughout Africa, actually, but in particular in South Africa. We're running out of time a little bit, so we don't have to have a hard stop. We can have sort of a soft stop. But I do want to say, if anyone out there listening on YouTube has any questions, you can put them in the comments and they'll get fed back to us. I don't know that we're going to have a lot of time for questions, but if you do, please do so. We're going to go now to Tina and then George, and maybe I'll just combine 4 and 5 a little bit in your reflections about question 4 that I've just asked around intersectionality. Maybe you could conclude your comment with something that's offering you some kind of hope and inspiration right now, and then we'll circle back to everyone else.
Okay, so I will try to be brief. I think we just have to acknowledge the inequalities and the injustice existent on globally, even on our local levels, and on each and every level. The world is just unjust, and people are affected different ways. And governments and institutions like police mean totally different things to different people. Being someone a white, privileged, cisgender, heterosexual man, it's a lot different than being a sex worker working in Brazil, and being a person of color and a sex worker and a trans woman, for example. So we just have to acknowledge these differences, and we have to realize that these differences are kind of growing. The gaps are bigger and bigger, and many people are suffering. And I think what is important to mention, the socioeconomic situation of people, that affects a lot, and that is often missing from discussions that we are having, that those being poor or living in poverty, their reality is just a lot different. And poverty is hitting those more marginalized and people who are having less intersectional privileges very harder. And we just have to acknowledge that all the time. Whenever we think, we speak, we just have to keep that in mind. I think it's really important. And what gives me hope, that's a very difficult question for me now. I don't know what gives me hope. Probably you people that I'm listening to, your hope gives me hope. That's the only thing that makes me survive these days. But that's my personal situation. Thank you.
Thanks, Tina. George?
Yes, very briefly. I think definitely COVID-19 has exposed a lot of inequalities. We have realized how unfair the whole system is. And being in lockdown here, can you have a safe place? Are you getting paid? Do you have the resources? Do you have the support system? Are you a refugee? Are you a domestic worker? So all these, they just came to the front during COVID-19. It was clear to everybody that very few people have the privilege to survive crises like COVID-19. But again, and this I will jump to what gives me hope. What's really amazing is that when we called out for the community, because we're working on certain donors' agenda and programs, it's hard to just shift everything that you're doing. But when we called out for the community, saying that we need help, we need to help each other, I felt suddenly that despite everything that we say, we're still a community that's willing to support each other. We're still there for each other, and we felt it here in Lebanon. That when we called for people's help, that to help those who are privileged, help those who are not privileged, we felt the support system that was created organically and naturally. And this really gives me hope in our community, and something that we should celebrate, that we still have this feeling and the need to support each other.
Thanks, George. And then Vivienne, back to you. What's giving you hope at the moment?
Sorry. Yeah, thanks everyone. I think moments like this also are part of the hope I feel, the possibility of talking and sharing understandings and strategies, even laments on the situation. I guess that the poetic, the practical, the survival strategies that LGBTQI communities have been imagining and also making real are is part of what makes me feel hopeful in a way. Seeing the artistic expression of many LGBTQI people flourish during the pandemic, you know, sending messages of hope that we survived worse struggles as a social group. We survived military dictatorships in many spaces in Latin America. We, as a community or as women, were involved in major struggles for bodily autonomy recently. So those things give me some hope that despite systemic marginalization, we take responsibility for mutual support, for data production even. Trans communities are leaders in that challenge of, despite having any space by institutions, by governments, we produce quality information on ourselves. It's not that we have many challenges in that, but we do work to some extent autonomously from many institutions and government that act against us. So I thank you for this moment, and yeah, hopefully keep in touch and keep surviving the pandemic as a community together and stronger, hopefully.
Thank you, Vivian. And Steve, you get the last word on this. What's giving you hope at the moment, comrade?
Well, Kim, my family gives me hope. My partner, my daughter, gives me hope. I think our world is faced with so many challenges. You know, you are seeing people, you know, die in front of you. You're seeing people killed. Every day there's a sad story. You know, and you still need to keep hope also throughout, and to keep motivated to ensure that even those you work with keeps it alive. But also what gives me hope, you know, it's many people across the world, you know, that holds us close to, you know, their heart. I think the fact that we have had solidarity from, you know, various partners, you know, we've had solidarities from DARC, from Outright, from Give Out, from Kaleidoscope Trust, and many others who check up on us, because at times we get drawn into the frustration, the realities that we are faced with. Our security, I mean, I had, because of political reason here of standing out, I had my house broken into just 2-3 months ago during this time. So that there's a whole issue about safety and security. And yeah, I get concerned, because for me, it's about how do I keep my family safe. So even with that, I'm encouraged with the fact that I've got my partner and daughter who are strong and who are holding me. I've got my team at AC2 who are also holding me, you know, and I also have many other activists and political leaders who also do contribute to giving me hope. So I think the fact that we are breathing, and the universe sometimes, no matter how difficult it is, responds in a positive manner. So that gives me hope.
Thanks, Steve. And all of you give me lots of hope. I just want to say, having worked in the movement for so long, that, you know, this is not a job for many of us. Some of us aren't even getting paid, you know, but this is a community of friends. And, you know, in moments like this, we need our friends. And you've all been very inspiring today. I wish I could give you all a hug. I can't wait till we're at a conference again somewhere where we get to actually have hugs. So thank you all for your time. I want to thank QP National, the Dignity Network, Fierté Canada Pride, ARC International, and Pride Halifax for helping put this all together. In particular, I also want to thank our ASL interpreters. It's not easy to interpret on the fly in the best of times, and especially over Zoom calls where, you know, connectivity is often a challenge. We really appreciate it. Thank you so much. And be well, everyone. Take care of yourselves.
Thank you.
Okay, goodbye.
Thank you.